All right, so we're gonna just show a brief first visit, or not first visit, brief chiropractic visit. And so this is my daughter Talia, and she's my model today. And anyways, the first time they come in, typically we do a consultation. We talk about their past history, things like that. Then we do a brief examination. Now the examination is typically just a chiropractic exam. I do range of motion. I test their neck range of motion from side to side, looking up and down, tipping left and right, just to see if that's been infected at all. We also do for the lower back, depending on what their complaint is, we'll typically check those areas and examine them. After I've examined them, I know likely what's causing it, and then I'll explain that to the patient, and then talk about treatment. And treatment can be a variety of different treatments, but in my office, we typically do a lot more hands-on approach. So I'll be using my hands to adjust the spine, but also I use different tools like massage with my hands, or I have some massage tools like a massage gun to help decrease muscle tension and spasm. So I've adjusted Miss Talia many times since she was a little baby, so we kind of have this down now. So I'm going to have her go on her belly like she would be starting out. First thing I do is I come in and just check the pelvis and how level it is, and check the spine and see where we're at. I'm feeling for movement in the spine to see if it's not moving very well, then I need to adjust that. In her case, right here on the sacrum part of the bone, right down here in the pelvis, is not moving properly. So in her, I'm going to use this little table to pop up and push down there, pop up, and push down there. There's a few other things that I would do, especially on adults and things like that, but I'm going to make this a little quicker, so I'm going to have her roll over on her back. Next thing I'm going to do is a mid-back adjustment, so her thoracic spine. I'm going to have her cross her arms like that, roll her just a touch that way, and then I'm going to roll her back onto my hand and give her a big bear hug. Good. And then one more. Good. Now that you typically hear a cavitation or a popping of the joint, perfectly normal, it's just the spine moving. Last thing I typically finish up with is the neck. I'm just going to show this in her case. She doesn't love this style of adjusting, but this is what I typically do for older people. So I'll tip and turn just like that. When I have that area that I want to adjust, I do a quick move just like that, and it'll adjust the spine back in proper alignment. And then we typically do the opposite side too. And then that can take anywhere between 5 and 10 minutes. And then I do some muscle work, and then we're good. So that's a snippet of a visit.